Hey everyone, welcome to the Mayo Clinic in Rochester, Minnesota. I'm John Kirby. I'm one of the third-year radiology residents and one of the chiefs. We know that with COVID and with virtual interviews, everything has changed over the last couple of years. One of the things that I remember most about my interviews was being able to see the hospital, see the reading rooms, and kind of picture myself being there for the next 4 years. But in today's virtual environment, that's something that's completely lost. So what we wanted to do was to take a few minutes to walk you around the hospital, show you some of these areas that we work in, that we hang out in, to hopefully give you an idea of what it's like to be with us for a day, as if you were here on a normal interview. If you have any questions about what you see, please feel free to reach out to us. We're happy to assist. Otherwise, we'll go ahead and get started with our tour. We're going to go ahead and begin our tour here in the lobby of the Gonda building. Gonda, along with Mayo, are the two interconnected buildings that make up the clinic building itself, where most of our time is spent and where the Department of Radiology is located. This is on the subway level of the Gonda building, and this is going to be one of the first things that you see when you walk in the morning. If we go up to the top of the staircase here and look out, the Department of Radiology is actually located just behind this statue, and there's a door you can walk out to be able to look out through the glass over the top of everything. About 30 feet from where we were standing at the top of the staircase are the 11 Chihuly chandeliers that were donated to Mayo and now hang from the ceiling of the Gonda mezzanine. Here's a view from outside of the clinic. This is that outdoor pavilion that you could see from inside of the Gonda lobby. As you'll notice here in a couple of minutes, both the resident lounge and the Carmen Library are both situated with views over the top of this pavilion. The next up on our tour is the Department of Radiology. This is going to be located on the second floor of Mayo and where we spend most of our time. This is where our education offices are located at, as well as the offices for most of our attendings, as well as our resident lounge. Here we are walking into the resident lounge and the Carmen Library. This is the exclusive space just for radiology residents and fellows within the hospital. We do have some lockers that were down the hallway that we just came down, which are right next to the mailboxes. Elsewhere in here, we have a lot of open space so that we can eat together, we can work on projects. We have a lot of computers along the walls. This is our teaching space where we'll have our medical students here. We also will stream lectures here whenever we're virtual. Going back into the actual Carmen Library itself, this is where all of our physical textbooks are going to be located. We do have a very large online library, but if there's ever anything we want a hard copy of, the education office will get it for us and put it back here. This room serves mostly as a quiet space for people who want to have meetings or online Zoom conferences. As we exit out of the library and we go around the corner, we have one more area that's kind of hidden back here with 6 computers for residents who want to come in and study, while also minimizing any distractions. Going back to the door that we just walked past, if we go out here and we go down these steps one floor, we're going to come out onto the Mayo mezzanine, which is immediately beneath our lounge. This area is for anyone in the hospital to use, but we probably benefit the most from it just because of how close it is to the department. As you look out here, you can see there are a ton of computers and desks. I have never seen these anywhere close to being full. We also have conference rooms that you can reserve for personal use or for meetings, as well as a lot of additional seating for eating lunch, which has been especially important in the setting of COVID and social distancing. Now we're going to go back up to Mayo 2 and exit out the department straight ahead. But no tour is complete without at least walking by the original CT scanner in North America, where the first scan was done at the Mayo Clinic in 1973, and now it sits on display here. As we walked out those doors, it took us to another hallway where our lecture hall is located. This is going to be where we have our noon conferences on Monday through Friday, as well as our resident-led conferences on Tuesdays and Thursdays at 4 p.m. Next, we'll take you up and show you some of our reading rooms. This is on Mayo 3, which is one of the main areas for our GI and GU departments. In total, we have 18 workstations in this wing, so it should give you an idea of what it's like elsewhere. As we walk into one of the reading rooms here, you'll see that they are structured all the same way, in which there is one desk for the attending, and then a resident desk that is immediately next to it. Almost all of our rotations are one-on-one, so it's nice to be in close proximity to the attending, especially for questions or for teaching. We have 3 rooms that are set up identical to this, as well as a couple of rooms that have 2 desks as well. All of our workstations are set up similarly in that they have sit-to-stand capability, as well as a separate computer that's next to the PACS monitors. It allows us to be able to look up information or look up any questions that we have without interfering with our images. Now we've taken the elevator to the 19th floor of the clinic building, which is the top floor. We're in the break room in between Mayo and Gonda. As we look out the west window, you can see the Mayo Clinic gym on the bottom right, as well as St. Mary's campus straight ahead, which is one of the hospitals that we also cover. Looking out the east window lets us look out over the city, including University Square straight ahead, and the Plummer building here on the right. This is the Peace Plaza, which is right in front of the clinic building. They have events here year-round, as well as food and music, and it's less than a 30-second walk there after work. Now we're on our way to Rochester Methodist Hospital, which is our inpatient facility that is located at the downtown campus. This is a 700-plus bed hospital that mostly has post-surgical patients, as well as colorectal, oncology, and obstetric patients. It's connected to the clinic building by multiple skyways, as well as underground walkways. This is where we take some of our first call and have a number of rotations, as well as where the employee cafeteria is located. Speaking of dining options, this is the main employee cafeteria for the downtown campus, located on the lobby level of the Methodist Hospital. It's currently undergoing remodel, but should be done within the next 2 to 3 months. Also on the lobby level, we have a large seating area, just in case you want to sit down quick and eat instead of running back up to the resident lounge. If you don't feel like eating at the employee cafeteria, we have multiple other restaurants within the subway system surrounding the clinic building. Things such as Caribou, Dairy Queen, Quiznos, and Subway, just to name a few. We also have University Square, which has a Newt's, which is a Rochester exclusive, as well as a food court with multiple other options as well. So far, everything that we've talked about has been at our downtown campus. Within Rochester, we actually have 2 main facilities that we cover, the downtown campus as well as St. Mary's Hospital campus, which is less than a mile away. St. Mary's is more of our traditional inpatient facility, and also where we have our emergency department, as well as level 1 trauma center. St. Mary's has about 1,200 beds, which are both acute inpatient as well as long-term. This is where we do most of our procedural work, as well as take most of our call. All of our rotations are self-contained, and we broadcast our noon and 4 p.m. lectures. We also have an employee cafeteria, so there's really no reason that you would have to switch between the 2 campuses, but if you needed to for whatever reason, we do have a free shuttle that runs throughout the day and takes less than 5 minutes. This is the main radiology area at St. Mary's, where we have our CT intervention, neuroradiology, as well as hospital reading rooms. Our hospital wing here is our newest addition, where we have our emergency, pediatric, and cardiovascular division rooms. These are our emergency reading rooms, where we take all of our call. We have one of our residents here who is reading radiographs in the evening. During the day, we usually have 1 attending, as well as 1 resident, and then a spot for an additional resident or fellow, depending on their rotation. In total, this reading room has 8 workstations and was designed to be open and collaborative so that if we have any questions, we're able to consult one another, but still be separated enough to be able to work independently. Here's a couple of our evening residents reading CT. This is where our overnight senior will come in to read as well. We do still have independent overnight coverage, and this is where they will be based out of. These rooms were also designed to be in close proximation to the CT scanners, as well as the techs, so that if we have any contrast reactions or any questions from the techs, we're in close proximity and can assist. We also have our pediatric reading rooms off of this wing, which has 4 workstations. We usually have 2 attendings who work here, as well as 2 residents that are rotating through. Our cardiovascular rooms are at the end of this hallway, where we have 3 workstations, usually with 2 attendings, as well as 1 resident. Our neuroradiology reading room is off of our main hallway. In this room we have 8 workstations, 4 for both residents and fellows, as well as 4 adjacent rooms for the attendings. Other main areas at St. Mary's that have reading rooms that are similar to this that we didn't visit for the sake of time include the intervention, ultrasound, and nuclear medicine practices. One thing that we do get asked about a lot is our parking. We do have access to covered parking available at no additional charge at both our downtown campus as well as our St. Mary's campus. Mayo also provides assistance services at both locations. In the event that your car doesn't start, someone will be there to help you. Both locations are within just a short walk of either the clinic building or the hospital, which is especially enjoyable when the weather is nice, but we also have underground walkways in the event that there's any rain or snow. The last stop on our tour is the Dan Abraham Healthy Living Center. This is the Mayo Clinic gym for employees and their families. It's incredibly convenient, located right next to our parking garage, and in fact, you walk past it every day going to your car. It has every piece of equipment you can think of, from free weights to plates to machines to cardio to just open areas for anything that you want to do. They also have a second floor with a running track as well as some additional equipment and other areas for stretching. They also have a large area for free weights as well as multiple squat racks and an Olympic rack as well. One of the unique things about the DALK is that it has a tiered system so that the more you go, the cheaper it actually becomes. For instance, when you first sign up, it's $30 a month, but if you go at least 3 times a week, you can drop that to as low as $20 a month. Other things that they offer include multiple fitness classes, cooking classes, spa services, and even a hydro massage bed. They do have 2 pools that are available for fitness, as well as a large locker room that contains both a sauna and a hot tub. While the main facility is located downtown next to the clinic building, there is also a satellite campus at St. Mary's, which has been impacted by COVID, but was previously open 24/7 at no additional cost. In the main dock, on the subway level, below the main workout floor, there's a restaurant that focuses primarily on health food choices, which gives an additional option for lunch. There's also seating here, both inside and outside, and this part is available to anyone to use, regardless of if you're a member at the DALK. We hope you've enjoyed our tour and at least a little sample of the hospital that we were able to provide. We're a large department approaching 200 attending radiologists, 20 fellows, and over 50 residents. And with that comes a lot of resources that we couldn't possibly show in one video. For instance, we haven't even talked about our scanners yet. Last I checked, we have over 40 clinical MRIs in use. But all of that being said, we're still a tight-knit group of residents. We look forward to getting to meet you, and we hope that if you have any questions at all, you'll feel free to reach out to us.